When someone tells you you look tired, invariably it means you have dark circles on show. And I think it is one of those things that no one enjoys hearing about themselves, and yet we really struggle to find good solutions to them. So today's video, I want to talk about why we get them, because there's a lot of different causes, who's most susceptible, and what we can do that will make a meaningful difference. Stay tuned. Hi, I'm Dr. Sam, helping you get closer to great skin days, just like I've done for thousands of patients in my Harley Street clinic. So I first started to notice my dark circles, I would say in my late 20s, and I don't think it's a coincidence that it coincided with the worst period in my medical career in terms of nights on call, poor diet, and generally not taking terribly good care of myself. So there is that association firmly in people's minds of dark circles, fatigue, not being in optimal health. It's kind of the opposite of being bright-eyed and bushy-tailed, yes? However, there are a number of different reasons as to why we get dark circles. Now, for many, it is a consequence of aging, and the impact of aging has a number of effects on the eye area in general. So the first and probably the biggest one is that skin thinning is a part of aging. Thin skin, and it's already a thin-skinned area, means that the structures that sit underneath the skin show through more readily. Now you have blood vessels and you have muscle, all of which have red-blue hues. So the problem with thin skin in the eye area is that it allows the structures that are underneath to show through. Think of a blue bra under a white t-shirt. Well, the same is true of the blood vessels and muscles sitting behind the skin around the eye. So as the skin thins, they become more visible. Similarly, we get changes in the tear trough. So this groove that runs on the inside of the eye becomes more prominent. That allows for more shadow to appear. And we also get a weakening of the general structures that hold the fat and muscle back. So as those start to protrude through, again, it changes the optics of the eye area, and that again allows for shadows to appear. And as a separate thing, we can have a problem with excess melanin. Now, that can be as a consequence of disease, for example, eczema around the eyes, or excessive sun damage, or even just something as chronic rubbing. But it can also just be part and parcel of your genetic predisposition. So certain ethnicities will naturally have a tendency to increase melanin and dark circles. And oftentimes it will be seen right around the eye. And that is just part of being you. On a temporary level, even puffiness can cause more shadowing than usual. Again, just due to different convexities in the eye area. So that's something to factor in too. So when we think about targeting the changes that cause dark circles, we can think about them strategically as well. So first off, let's think about excess melanin. So if the problem is due to an inflammatory process, eczema for example, then the solution is to tackle the inflammation in the first instance. So that means getting the eczema under control. Oftentimes the pigmentation, much like we see with acne, can last for a significantly longer period than the inflammatory dermatosis itself. So keeping it controlled long-term will allow that pigmentation to improve and resolve over time. In the event that it's sun damage that's triggered the hyperpigmentation, then our usual tools are going to be of value here. So that's vitamins A, B, and C at levels or potencies that the eye area can tolerate, in combination with regular use of sunscreen, broad spectrum, to block that UVA rays that are triggering changes in the eye area, is the best way to approach it. Now, when we think about dark circles in context of skin thinning, then we have two approaches. The first one is to thicken up collagen. So with a similar approach to that which we talked about in last week's video, looking at improving the skin to prevent and treat eye wrinkles, it's the same with dark circles. If you can make the skin thicker, then those blue structures become less visible underneath. But sometimes the issue is the blood vessels themselves. They can become weaker and more fragile, and that can result in leaking of something called hemosiderin, which can again contribute to dark circles. The way to tackle this is with topical vitamin K. Now, I like a product called Cherno XO for this purpose. It helps stabilize those little fragile blood vessels and can help improve the appearance of dark circles over time. Similarly, you can seek out vitamin K in your diet, and this can be found in tomatoes and in cauliflower and in leafy greens. So again, a great way to adopt an inside-out approach to a beauty problem. Now, as the problems become more structural, so due to fat loss, which is influenced both by aging, but also things like smoking, and changes in the way the muscles and the fat sit in the orbit as they bulge through, as I said, that can change the contours of the eye socket, the tear trough can deepen. We then move into the realm of procedural approaches. So whether we're looking at a blepharoplasty to strengthen everything and to remove the prolapsing fat, or whether we're looking at tear trough augmentation with hyaluronic acid to help reduce this groove that deepens as we age. The key thing in all of this is to seek out expertise of an individual who deals with the eye area. I'm a big fan of going to an oculoplastic surgeon for this. They're in that territory all day, every day. It's their bread and butter, and they will give you the best advice around which procedure is going to make the biggest impact. Because sometimes there's more than one factor at play, and a combination will work best. And then, of course, sleep plays a role. All of us tend to just look better in this area whenever we've had a good amount of sleep. There is something about lack of sleep that I think leads to dilatation of the blood vessels, and all those bluey vessel structures underneath the skin can just become more visible. So I think in those instances, there's nothing to beat good hydration to help plump up the surface, to reduce the appearance of any fine lines, and to improve the surface for application for concealer. Every girl and boy needs a good quality under eye concealer, ideally with some peachy orange tones. This will help neutralize the blue in your shadows very effectively. So dark circles, something to consider. It's definitely worth working out what the source of the dark circle is, because I think that if it's part of your genetic makeup, making peace with your dark circles is probably for the best. You can't really fight the way we're built. But if there is a reversible cause in the mix, then I hope I've given you a structure for how you approach it and what tips really make the difference. This is the second in my eye series, so if you haven't watched last week's video on improving the appearance of wrinkles around your eyes, do catch up and watch that too. And I'll see you guys again very soon. Bye for now.